And a big welcome to our live audience for the Digital Health Investor Talk show. I'm your host, Stephen Wardell. I'm the managing partner of Wardell Advisors, a digital health advisory firm, and the author of The Future of Digital Health. Wardell Advisors is helping digital health companies address issues around growth, fundraising, trade sales, and strategic alternatives, giving you more options in today's challenging environment. You can follow me at x.com/Stephen Wardell. Our show today is on the topic of innovators move to tech-enabled services, and our guest today is James Hueston. Is it Hueston?
Yep, like this.
James is an investor at Primetime Partners and the founder of agetech New York City and First Gen. You can follow him on LinkedIn and Blue Sky. This show is being recorded and will be included in our podcast series called the Digital Health Investor Talk Show. Subscribe to our podcast on Apple and Spotify and leave us a review. We have new podcast links for the shows, so make sure you see recent episodes when you subscribe, or you could be subscribing to the old page. This is not investment advice, and we are not investment advisors. Here's the format for today's show. It's 90 minutes long, and James and I will spend the first part discussing the news and macro picture and some other topics, and then we'll focus on the topic of the day after that in the second half. And we'll be taking your questions throughout the show in the LinkedIn text chat, so feel free to type your questions in there for us. So James, welcome to the show.
Awesome. It's great to be here,
Please
Stephen.
introduce
Thank you so
yourself
much
to our
Yeah, absolutely. More than happy to. So I'm an investor at an early stage venture capital fund called Primetime Partners. We focus exclusively on backing amazing entrepreneurs that are helping older adults and their caregivers to age happier, healthier, and longer as well. The firm itself has been around for about 5 years now. We're investing out of a $60 million fund too that we recently closed. And we're a small team of 5 investors that are very, very focused and excited about the trajectory of the space overall. In addition to that, you also mentioned 2 of the other things that I help run on the side, one being agetech NYC, which I co-founded with Sarah Richard, who is an amazing founder herself. And we have now grown it into one of the largest communities of its kind in the world, bringing together close to 100 people on a monthly basis that span the entire care continuum, from founders to innovators to consultants to people in industry at health systems, senior living, and home care. And that's been a great project too. And then First Gen, lastly, is something that I work on with another gentleman named Matt Kaliski. He started First Gen originally back in 2018 to help first generation immigrant entrepreneurs get their first million in capital or their first $1 million in customers. And so he's been able to help close to 75 founders through that journey. And as part of that, I joined him last year to start First Gen Funders, which is focused on getting first and second generation immigrant investors a support group and a network to eventually help bridge us to making the decision-making stage at some point in the future. So a little bit about me, but really appreciate you taking the time to have me on the show and really excited to chat more about everything we're seeing in digital health and tech-enabled services going forward.
That's great. Thank you. And welcome to the show. So our first topic here is macro news, where we chat about market index levels, inflation, interest rates, jobs, unemployment, and try to make sense of things and even see into the future a little. And for our audience, feel free to throw any questions you have in the chat. And we try to relate this back to the innovation economy where we live. So the market has been seeing a lot of gyrations lately, all centered around the current sort of trade war and tariff controversies that are going on today. The market was actually up today, ultimately a few hundred points last we checked. And it's on the sentiment that Trump is pulling back his criticism of Powell on interest rates. Trump wants Powell to cut interest rates. No one knows what Powell's going to actually do. The next Fed Open Market Committee meeting is in the first week of May. And also that Trump seems to be open to a near-term tariff deal with China. This is after it looked like there was no possibility, or there were escalating tariffs and no near-term tariff deal with China. It's people thinking that the worst may be past us, perhaps. But the NASDAQ is still down over 10% since the start of the trade war. And is now in the neighborhood of around 16,900 or so. And this is generally bad for the innovation economy. What we want high stock prices for a number of reasons. Number one, we want stability about the future. We want people thinking 3, 5, 10 years out instead of about saving their portfolio from a 10% correction in a month. And we also if equity valuations are high and growth stocks receive a high valuation multiple, it means the companies we build will ultimately be sold for a high multiple down the road. So this kind of stuff is mostly bad. Intriguingly, the idea of a different tariff regime that sort of privileges Americans inside the country, that could be intriguing for a number of things. It could be intriguing for entrepreneurs building and selling things inside the U.S., but that's farther down the road. So, James, what do you make of the tariff deal, the criticism of Powell, and the market gyrations?
Yeah, absolutely. So I think that it's a lot to unpack, and I think that I would be speaking out of turn to say that I had any idea what was going on. I can speculate, but I do think that the only certainty we have now is that we live in uncertain times, right? And a bit about my background so that I'm not speaking completely out of hand. I studied macroeconomics in college. My degree was in applied financial econometrics, and so have some expertise and knowledge around some of these macro moves. And so I think that historically, if you look at a lot of the trends, there have largely been big recessionary periods or even depressions after most major tariff moves that the US makes. Two of the biggest depressions in US history were both triggered in the year or two after tariffs went into effect. And so historically, tariffs have been seen as kind of a last ditch effort move in order to try and secure nearshore interests. And so I think that the administration has put them into place with the idea of kind of reaffirming our position as a trade partner, but also a trade.
So it looks like we have a connectivity issue with his connection to the show. And so I'm just going to keep going and we'll see if he rejoins us. So the next I'll mention is that healthcare is often seen as being a very domestic industry and also one that's recession proof. But it's not so much today. That healthcare is domestic in the sense that haircuts are domestic and healthcare has to be provided by American service people inside of America. But its supply chain is very global and very dependent on countries like China. And so we could see the components of pharmaceuticals go up in price. We could see consumables used in surgical procedures go up in price. We can see medical consumables, etc. So those are the ways in which we're affected by these tariffs. So next is the Fed. Is entrepreneurs and investors very much want to see the Fed lower rates, and the Fed's expected in general to lower rates, but only if inflation is under control. And it's not clear whether inflation was under control before tariffs, and it's not clear whether we will get inflation or whether inflation will spike with tariffs. And so people are watching whether the Fed makes cuts. We would like to see the Fed make cuts, but I think the chances of it making cuts at the May meeting is not clear whether they will do that because there's a threat of further inflation from tariffs. And so then there's also a question of, are we in a recession or about to go into a recession? And so theoretically, we are at a phase of the economy where we ought to be going into a contraction, a recession. And this has been true for over 2 years. So how can that be possible that you're supposed to be going into a recession, but you're not in a recession for 2 or more years, maybe 3 years? And the answer is actually war spending. And so we were due for a recession around the time of the Russia-Ukraine war. And since then, we've been spending with enormous fiscal stimulus on 2 wars, the Ukraine war and the Middle Eastern war. And so that is thought to have forestalled us going into a recession. But we don't usually get to skip recessions. And so there's a thought that we may be finally seeing the recession catch up with us. And for our audience, any questions about economic indicators you've seen in our audience? And so I'm getting news from James, by the way, that the Wi-Fi in his building has gone out. Let's see. And so we'll keep the show going. Hopefully that he can resolve this issue with Wi-Fi in his building and rejoin us. So next I'll move on to the administration's policies. So the administration's policies are expected to have a very big impact on healthcare and, creating winners and losers and in healthcare. And we're very, very concerned at people being hurt by these changes, but there could also be some changes that create opportunities for innovators as well. And for our audience, if you want to throw any comments in the chat or have any questions about these administrative policy changes. But I'll give an example of this. So RFK has cut staff from the FDA, and people in medtech and biotech believe this means that it's not going to speed up their approvals, and it could slow down their approvals. So that's one. And then at the National Institutes of Health, there have been cuts to research grants. There's 2 kinds of cuts to research grants. One is where the administration just says, we will pay less for the administrative support component of the grant. And this causes a problem for the research institutions and universities. And the other one is when they cut or change the grants entirely. So this is bad news for people who are pursuing certain lines of biology research, for example. Could be good news for new grantees due to a change in focus, but it tends to be bad news and create dislocation for grant recipients who no longer receive grants. And then also there's some speculation that RFK could block pharma DTC advertising. There are many pharma brands that advertise direct to consumer. If they could no longer advertise direct to consumer, then they might feel that they are going to cut back spending on their tech vendors, for example. So welcome back, James. Good to see you.
Hey, Stephen. So sorry about that.
Oh, no problem. So we were just talking about Trump policies, and I mentioned there's cutting staff at the FDA, cutting or changing research grants, cutting the administrative component of the research grant. And there's rumors RFK might block pharma DTC advertising, and that could affect those brands, and those brands spend on tech companies that support the pharma commercial budget, for example. And so those are some areas. What have you been hearing? Have you heard of other areas where there's a change in priority, a change in spending, a change in regulation that's affecting different parts of healthcare?
Yeah, it's a great question, and I think that is pretty endemic with what we were chatting about earlier, right? Which is that the only certainty is uncertainty at this point. And very sorry that I dropped. I will blame Spectrum Internet on this one. They cut out at just the worst moment, but glad to be back. Circling back to your question, though, around potential headwinds that we're hearing, I do think that a big one is, in addition to the cuts around pharma budgets and the ability for them to power through clinical trials, it's also not even about the budgets. It's truly also just about the human power necessary, right? At the end of the day, if you cut 10, 20, 30, 40% of a workforce, those were all people that were doing very important jobs and doing a lot of very important research, doing a lot of very important approval processes and things like that. And so by either laying them off or causing them to be fearful for their jobs or their roles, those jobs no longer get done, right? And so even if they're not going to be directly cutting funding, or even if they're going to directly cut their ability to advertise, they're going to feel it already in their ability to accelerate their drug pipeline review processes and everything else that they're going through. So I think we're going to see a massive slowdown in the innovation economy there. And then on the other side as well, it's not even just the employees that are fired that are directly affected, right? Every other employee that I know who works in the federal government is very worried about the future job stability that they have. And we know from a lot of the work we've done around financial wellness that job stability is one of the number one impacting factors when it comes to productivity. And so even the employees that are left around there, they likely will face dramatic hits to their ability to be productive and focus in the work they're doing. So it's honestly not even the funding that scares me as much. It's honestly more the people power that's going to be directly impacted by the uncertainty that's coming.
Yeah, interesting. And then I'll also mention, we like to look at this from the perspective of what I call the innovation economy. And so you can have a change in priorities. So usually from administration to administration, the federal grants for basic biological research stay roughly the same. So you have someone like Francis Collins is at the top, and there's a lot of continuity there, and he is doling out money to researchers, grant money to researchers, and inevitably he has kind of favorites. He has favorites he's been giving money to who've been delivering results for a long time. And this is both a good thing and a bad thing, because he's persuaded that these are the right people with the right overall priorities, the right people, the right kinds of results. But there also might be some genius young people who are overlooked because there's no way for them to raise their hand in this process and say, give money to me, but not this other guy. And then you have a real changing of the guard, and someone who comes in and says, my priority is to reduce funding. I'm just making this up. Reduce funding on pulmonary disease, increase funding on autism. So it's fair for new administrations to have different priorities exactly like that. There's much more discontinuity this time. Francis Collins is out. There's new people. They're cutting funding to old priorities, adding funding to new priorities. That's fair. But the problem for the innovation economy is that the way it works is government funds basic research, and only years later, and then private industry and entrepreneurs pick up that research after it's gone through translational, and when it's nearly ready to commercialize, government stops funding when it's ready to commercialize. Private actors come in, grab it, and then try to commercialize it, do the risky, hard process of trying to commercialize it. And so if you cut, in this hypothetical example, pulmonary disease funding today and increase funding to autism research today, then there's this dislocation and gap, because that extra money into autism is not going to produce results that can go to the commercialization people for 5 years, or maybe more than 5 years. And so those commercialization people are going to be expecting product to come out of basic research they can run with, and it's going to stop, and the new stuff isn't going to fill back in for years. So that's when you have this kind of dislocation, that's how it affects the innovation economy. So, and for our audience, any other questions about this? But with that, or any other future administration policies that you've been hearing people in the industry talk about or be concerned about, James?
Yeah, so I think a big one that we've heard time and time again is the focus on reining in Medicare Advantage upcoding and recoding. So really focusing on the potential fraud, waste, and abuse that exists in the industry. And we know that it does exist. The question is how much and where. And so this administration has publicly stated, and privately as well, that they're really going to focus on how to better incentivize the usage of codes, how to better track the correct usage of codes, and really trying to make sure that people are better aligning around preventative care measures as opposed to just what gives the highest coding rates, which has been a problem for a while now. But I think you made a great point around the dislocation effect that we're going to see here, right? And I didn't get to finish my point earlier about tariffs, but I think it's the exact same thing, right? Where to me, this administration, it seems like they feel that there will be immediate and amazing responses to a lot of these actions, not taking into account how long it takes to do that, right? So with tariffs especially, the move is that ideally companies will start onshoring a lot of the manufacturing that they offshored over the last 40, 50 years. The problem with that is that most of these factories take 5 to 10 years just to spin up, to set up, especially in the high-tech industries. And so there's that same dislocation there that we're going to see when it comes to scientific advancement and the commercialization of that technology. One of the scariest statistics I heard was that they surveyed about 1,500 really advanced PhD researchers, and about 75% of them said that they were strongly considering leaving the country within the next 6 months. And so if you lose that level of innovation economy and you lose the funding towards it, maybe we'll be okay for the next year or two while the end of the pipeline kind of shakes itself out and gets commercialized now. But moving forward, I do think that there will be a lot of pain there. So that's kind of what we've been thinking through. I think it's going to be harder to invest in things that need FDA approval, that require that pipeline. And so I think companies might be looking to other countries and figuring out what their approval processes look like and how their clinical trial operations are set up. So that would be a potential trend to invest off of. And then the last one I'll mention is that if we're going to be disincentivizing MA, well, where are we going to incentivize the care and incentivize the focus on cost cutting? And the answers we've heard has been that ACOs have actually been surprisingly effective, and CMS has been very pleased with them. Early programs like Guide have seen overwhelming success and support as well. And so we've heard that they're likely to increase funding towards ACOs and towards these other sorts of more experimental incentive programs.
Really interesting. That's great. Thank you. So now moving on to the next part of our show, which is business and trade journal news stories. So for our audience, feel free to throw comments in the chat, any stories you want us to comment on, that sort of thing. But James, I was looking up all the fundraisers that have been announced in the last couple of weeks in preparation for this show, and I didn't find a lot. And so I'm wondering if this is the Trump pause. And the Trump pause is that CEOs and fundraisers need to raise money just as much as they ever did. But investors feel more uncertain and have the luxury of just saying, maybe I will just do nothing for 2 months, and I can still have introductory calls, and I can still do due diligence, but I'll do work. But when it comes to investment committee meetings and greenlighting investments, we can just wait and see. In a month, we'll know more. In a month, in theory, the trade war could be over, or it could look more concerning than it does today. And so, what do you think? Are we seeing a Trump pause?
Yeah, I definitely think so. I think that what I'll say, though, is I don't think it's just related to Trump. I think it's an overall pullback from the venture ecosystem when it comes to investing in very, very early stage innovation. I think that in addition to the Trump pause, the rate of innovation and technological change that's happening due to the advent of AI is moving at such a fast rate that it's actually leading to uncertainty over where to even place bets, right? As a venture investor, I'm trying to make 7 to 10 year time horizon investments, and the technology is iterating so rapidly that even 2 years later, a lot of the first Gen AI companies are really running into a lot of headwinds because the technology has now even eclipsed what they were doing 2, 3 years ago. And so I think due to that uncertainty, plus the Trump pause, as it were, I think you're definitely seeing that decrease in capital allocation. And I think what's really counterintuitive, right, is that to your point, us venture investors are really taking this long-term time horizon, and we have the luxury of stepping back from things when they're more uncertain. But one would think that if we're taking a 7 to 10 year bet, these short-term macro fluctuations might not have an impact on our thinking process, right? Over the 7 to 10 year time horizon, any sorts of near-term fluctuations should smooth out over time, right? But the issue with every venture-backed startup is that they're constantly burning cash, right? There is a set runway that they are running up against at any given moment. And so if that runway is coming to an end, they need to raise regardless of the venture environment. And so everything that we're counseling startups on is to extend runway as much as possible, to continue to be as operationally efficient and lean as possible. And so it's not just that funders aren't investing in companies right now with the same level of risk tolerance. It's that founders aren't looking to raise at this moment in time either if they can avoid it.
And there's an interesting example of the rate of change that I heard, and it's worth recounting to you, but it has to do with the way we're all watching this wave of generative AI foundation models play out. And the first announcement was ChatGPT, which was two to 3 years ago. And so much has followed in the wake of that, and several companies making enormous investments in their own foundational models like Claude and Gemini and Grok and Meta's LLM and others. And investors were willing to put $50 billion, $100 billion dollars into these at ridiculous valuations on the premise that this was like the airplane manufacturing business in a sense. The analogy was airplane manufacturing. So there's only 2 major airplane manufacturers and a couple minor airplane manufacturers because the capital cost to get into this. I mean, James, what if you tomorrow decided to make a major airplane manufacturing business and go into competition with Boeing and Airbus? How successful would you be? What kind of, how in raising money, in building out a plant or whatever, given that the world market is well served by 2 large manufacturers today. And so that was the bet they were making, was that there would be only a few of these, and by being early, you would be in one of the winners, etc. With foundation models, you don't have to build out a giant aircraft manufacturing plant in order to build foundation models. But what you had was that testing the model and operating the model were both extremely expensive. And so competitors just couldn't jump in and do this. They couldn't credibly raise the money to do it. And then all of a sudden you had the Chinese DeepSeek product and announcement. And suddenly it looked like here was a product that was nearly as good as OpenAI's latest model. And the moat was that it was hard to train the models, that it was extremely expensive to train the models, it was extremely expensive to operate the models. And DeepSeek was cheap to train and cheap to operate. And so you just had 30 of the world's greatest investors had put tens of billions of dollars into 5 American foundational models based on a premise that just evaporated. And so what is OpenAI's moat today? And we don't know yet. We're still figuring it out. So that's just an example of the rate of change.
Yeah. And I think, Stephen, to piggyback off of that, I think what's even more concerning is that it's not even just DeepSeek R1 that likely had more funding than I think they're letting on from the Chinese government. But there is a foundational model that just dropped today, actually, out of Korea. It's a foundational voice model, and it was put together by 2 undergraduate college students in 3 months who knew nothing about voice AI, but took a lot of the online courses that a lot of these companies offer, really got up to speed as fast as they could. And they just dropped an open source voice model that is now number 2 on the Hugging Face leaderboards. And they did it with way fewer parameters and entirely free compute offered by Google without raising a single dollar. And so to me, it really speaks to the democratization of this technology and the rate of innovation. And to your point earlier, at least to me, I don't know how everything will shake out, but I do know that if I'm investing in technology, I also want to be investing in the services attached to it that I believe will be the durable moat moving forward.
Great. So then, in terms of a fundraise, and I'm going to start skipping some things in our show plan just because we don't have, because we're running out of time. So I wanted to call out a really interesting fundraise. This is Superpower announced a fundraise, I think, just earlier this week. That it raised a $30 million Series A round. They have one of their products is a comprehensive biomarker testing offered twice a year, and they promise health for the consumer that is proactive, preventative, and personalized. And they're promising the same kind of high-touch concierge care you might get from a longevity physician, which might cost $20,000 to $100,000 a year in the U.S. For $500 a year instead, with an app and with you have a medical case manager who knows your case, and you have custom data. So that's the story. And the CEO there, Jacob Peters, backed by what I thought was an interesting syndicate. Of course, this is a consumer product, and most healthcare investors don't like investing in consumer. And so you had Forerunner. They're a consumer and health fund, and they were the lead investor, Kristen Green there. Other funds, including Day One Ventures and Sousa Ventures and Long Journey Ventures, very interesting, and the Winklevoss brothers as well. So very interesting. This is building on the trend we've seen of very popular influencers. In this case, it would be like Mark Hyman and Andrew Huberman and Tim Ferriss to a certain degree, Anthony Robbins to a certain degree, Peter Diamandis to a certain degree. They have identified and drawn out of the mass U.S. market the people who are interested and care about longevity, also performance health, optimization, health span, healthy living, and it's become a growing market. So it's interesting to watch this and to see a significant round get raised in this. So that's one. And then also I saw that Equitage Ventures, which is an age tech fund. There aren't that many. There's probably about 12, I think, and you guys are one of them. Primetime is one of them. But Equitage raised, I think, a second fund at about $50 million to meet the needs of seniors. And the way they phrased it was seniors' needs, including the physical, mental, spiritual, and social needs of seniors. So very interesting. That's a distinct thesis from the digital health thesis. So it'll be interesting to watch that play out. So James, any business or trade journal news that you thought was worth calling out this past week?
Yeah. So first off, just wanted to give a shout out to my boy Danny Kaplan over at Equitage Ventures. He's a real one. He truly cares about entrepreneurs and cares about building amazing, sustainable businesses for older adults. I have known him for 4 or 5 years now at this point, and have nothing but amazing things to say about him and Equitage. And we're really excited to see that there's more capital going towards our sector. We truly believe that there's so much opportunity and room for innovation here that we'd rather be collaborative with firms like his as opposed to competitive, right? There's a rising tides lift all boats ecosystem that's being built there. So hats off to Danny and the rest of the Equitage team. Excited to work with them moving forward. And then I do think that Superpower was a great announcement as well. We spent a lot of time in the longevity space, and I think you hit the nail on the head, which is that there's really not a lot of differentiation between a lot of these solutions. And so it really comes down to distribution and how do you build trust and brand in the industry. And I think to your exact point, by partnering with really influential wellness and health influencers and life coaching people, that is a great way to break through the noise and break into the market. And so I don't think this will be the last one we see get funded like this, but it's definitely one of the first ones. And I think that it speaks to the rising consumerization of healthcare, right? You and I both know that healthcare, as amazing as it is, has a number of problems that are pretty structural and institutional. And so this, I think, is an end around play that people are making to go after the consumerization of it. Happy to see that continue to happen. And then I think in other industry and business news, I wanted to give a shout out to some of our portfolio companies that recently closed fundraisers as well. So Open Loop Health in our portfolio has grown 25x over the last year or so and raised a very large Series C recently to really power the back office in a box for telehealth companies. Setting up your own telehealth practice can be a total pain in the ass, and they really help make that process as seamless as possible with over 25,000 clinicians that are now on their platform.
That's great. So now moving on, for our next part of the show is a part that people love to hear about, which is, what is a technology that has improved your life in some way? What is something that has sort of made your life easier? And I will call out, most people don't know this, but the new generation of travel chargers. So there are new travel chargers that are smart and faster, and they usually go direct USB-C to USB-C. And so you can replace and they're powerful enough to charge a laptop. So most people have laptops these days that receive USB for charging. And so you can have a single charger that runs a couple of USB lines out of it. And with it, you can smart fast charge your laptop, your iPad, your iPhone, and your headphones, all from a single device. So you don't need to carry around your Dell charging brick anymore. So you just need one of these for everything on your next trip. So that's one that I'll call out. And James, do you have any technologies that our audience can use that makes their lives better?
Yeah, absolutely. The first one is actually a piece of technology I'm wearing right now that you might not be able to even notice. So these glasses actually are smart glasses. So they actually have a holographic display in them that can project out about 6 feet in front of me. So they're currently off right now, but when they're on, what's so cool about them is that it has a real-time heads-up display for your life, basically. So it can provide real-time directions as you're walking or biking, real-time notifications and calendaring, weather reports and updates, and then obviously the time. But what's even cooler beyond that is that if I hold on the right thing here, I can translate in real time over 30 different languages. I can take any voice note I want. And then on the left side, I can talk directly with my ChatGPT instance as well, which is really interesting. So these don't have always on microphones. You have to activate them, which I really like from a privacy preserving standpoint. And they also don't have a camera, which I also prefer from a privacy preserving standpoint. So these glasses truly do feel like I'm living in the future in a lot of ways. It's a real-time live heads-up display, like as if I was in a video game. And they've been amazing to use the last 2 months. So they came out this year. It's from a company called Even Realities, which is based out of the UK. And they launched at CES. And what was even cooler is they're fully prescription for my prescription. And they also are HSA, FSA eligible too. So would definitely recommend checking them out to interface with all of the newest tech that you're already working with, but in the kind of real world without necessarily sticking out like a sore thumb.
So how does a screen exist? Is there a tiny screen you're looking at, or is it directing rays into your eyes or something?
So it's directing light rays into my eyes, which basically creates an effect where it looks like there's a screen about 6 feet out in front of me. So the way it works is it's not just a singular lens. There's actually 2 lenses that are very, very close together and very thin. And then at a certain part of the lenses, they actually make them more mirrored. And so the light can refract in interesting ways. And so there are 2 tiny little projectors in each end that project light between those 2 panels. And it then reflects perfectly back into my eyes so that projection looks like it's about 6 feet in front of me as a holographic display.
And I would not have guessed that was true about those glasses. And the frames don't look big enough to have battery and other things that are presumably needed. Interesting. And it sounds to me like the future of the movie Her, which had Joaquin Phoenix in it, is closer than ever. And I've heard and what are those called? VR glasses or XR glasses or something? Is there a product category?
XR glasses. So I'm not wearing them now, but actually I use XR glasses to work when I'm on the move. There's a great company called XReal, and I have a pair of their glasses. And you can basically set up a virtual desktop that gives you the screen capacity of 3 major screens, but it looks like you're just wearing glasses. And it just plugs directly into your computer or your phone using a USB-C cable. To your point, it definitely does feel like we're truly living in the future in a number of ways.
What's the product category name of the glasses you're wearing now?
So the product category of these ones would probably be like AR smart glasses, so augmented reality as opposed to virtual or extended. Yeah.
AR glasses. And Daniel in the chat asks, are they heavy? And do they feel heavy on your nose and the front of your face?
They're not heavy at all. I can wear them for a day at a time, for 15, 16 hours at a day while I'm out and about. And there's no wear and tear whatsoever. They weigh just a fraction more than my regular glasses, which are very thin. Most of the weight is back here in the ear part. And so it sits behind your head. And so it doesn't put weight over the front. And then they have these very soft silicone siding parts that nest easily over your ears. So no, I've had absolutely zero issues with the comfort of these.
And can you say the brand name again? And I'll put that in the chat.
Yeah, it's Even Realities, EVEN.
So I've heard a joke along these lines, which is for AR glasses, which is that the AR glasses are the resolution to the Fermi paradox. So the Fermi paradox is that in theory, there's billions and billions of planets where life could originate, but we are all alone. We can't detect a single other source of life in the universe other than Earth. And so what's the resolution of this paradox? And the paradox is resolved by AR glasses, which is that each of those planets had a civilization that developed AR glasses. And at that point, all subsequent progress stopped and everybody just sat around, being entertained in their AR glasses. And then eventually the civilization died.
Yeah.
So that's
it's certainly possible, right? I think that, so another thing you may not know about me is in addition to studying economics in undergrad, I also studied physics actually as well. And so to your point around the Fermi paradox, I think there are so many different proposed answers, but the best one that I've heard and can really wrap my head around is that either it's 50-50, right? Either we're kind of alone in the universe and we're the furthest to ever make it, or there's some event that we haven't crossed that will kind of wipe us out. However, that being said, NASA recently announced that there's likely some really compelling evidence that they found signs of life on another planet. And so within 2 to 3 years, we might be able to have full confirmation of life elsewhere. What most people don't realize, though, is that we are so cosmically distant from most places that could sustain life that literally it takes the light from those planets thousands, if not hundreds of thousands, or even millions of years to even reach our eyes. And so because of that, even if there are other intelligent, smart civilizations that are out there and exist, the chances that we overlap with them are still incredibly small, and even smaller that we would observe their light at the exact moment in time they were advanced enough for us to see it as well. So who knows where that paradox gets resolved, but it's definitely a fun thought experiment.
Great. So the next section, and at the 45-minute mark, we're going to try to switch over to your topic of expertise. But first, any trade shows coming up that our audience should know about? I'm going to just call out Device Talks Boston coming up April 30th next week in Boston for medtech companies. They have a chance to pitch and also to write to meet investors. And I would recommend doing that. It's kind of short notice for that one. The Digital Healthcare Innovation Summit in Boston is coming up May 19th to 20th. This is an independent investor conference in digital health, and it's the best investor conference in digital health on the East Coast. It's every year. And I'm going, and I have a discount code here for our audience, HIS25, partner 25. So you get 25% discount on the ticket price of that conference. If you're raising money, I would, write to investors in New York and Boston and say you're going to this conference and you want to meet with them at the conference. So that's a use. It's also known for its excellent programming on healthcare investor topics as well. And then the Aging Code Summit coming up. This is Longevity Global, which is a nonprofit in longevity, is putting on a conference in Boston, June 11th to 12th. And the theme of this is the use of AI in longevity, especially as applied to longevity biotech. So AI software, it's the intersection of AI software and also molecular biotech as well. The Aging Code Summit, June 11th to 12th in Boston. And I'll be attending that as well. James, any conferences you think should be called out to our audience or that you're attending?
Yeah, so there's two. One of them is actually tomorrow. It's the Startup Boost Health Tech Summit here in New York City. A big focus on AI applied to healthcare. I and several other investors I really respect will be there. And so if you can make it tomorrow on short notice, definitely worth checking out. The other one I would shout out would be a conference called MedCity Invest, which is based out of Chicago each year. It happens in late May. And I've always found that to be one of the more insightful and intimate conferences really focused on this space.
That's great. Thank you. Lastly, personal notices. So this is a chance to mention to our audience if you're appearing somewhere or ways they can get in touch with you or things that you're doing in person. And so I'll just mention that the next episode of the show is coming up May 7th, and it's called Now We Need to Win the Scale Game. And it's with Chrissy Farr and Alyssa Jaffe. Most people know those people. Chrissy Farr has her own fund now, but she was a news correspondent covering healthcare for a while. And Alyssa Jaffe is a partner at Seven Wire Ventures, and they're talking about how young companies need to scale up by any means possible, including through mergers, in order to matter more to the incumbents that they sell to. And then I'll also mention I have my annual Digital Health Beach Party coming up in Marblehead, May 3rd. The theme this year is AI and healthcare. And, write to me after the show if you want to apply to attend the beach party coming up. So James, any personal notices?
Yeah. So I think that big one would just be to shout out agetech NYC and First Gen. We have Luma pages up for both of those. If you just type in agetech NYC Luma or First Gen Luma, you can subscribe to both of those calendars and mailing lists. We have monthly events for both, and we think that they're incredible resources if you're ever around the New York City ecosystem. And then last thing that I'll shout out as well on a personal front, I will be at the upcoming ARP Innovation Conference that's happening over the summer as well.
That's great. And you mentioned the Startup Boost Health Tech Summit New York City. That's tomorrow. Yeah. Are you going to that?
I'll be there. I'll be both a panelist, but also a judge for a number of the startup competitions that are happening.
And so that's an obvious thing. Anyone in the audience who is in New York City and you're at all curious, are you age tech curious? Then you should go to the very next age tech event. And I think you said that they're all on Luma. And so they should type in age tech NYC Luma and they'll find the next event. And are you guys going to do a picnic?
Absolutely, at some point in the future. So I live relatively close to Central Park here in New York. I grew up in Denver, Colorado, and always loved the outdoors and nature. And now that it's finally starting to feel like spring, you can count on me being out in Sheep's Meadow. And so I'll be out there, whether it's myself or whether it's with others. So definitely keep an eye out on both those invite lists, and we might get a big picnic together for either one.
That's great. So now we move on to the second half of our show, which is the main topic. And the main topic is Innovators' move to tech-enabled services. So the last decade has seen unprecedented innovation in digital health and age tech, but software companies still have trouble selling. And there have been few compelling exits in the sector, which is very worrying. And in response, some innovators today are now turning to tech-enabled services instead of merely software companies. And so, James, I'm just going to ask a really big picture question because you have a great perspective to be able to answer this. But if you had gone to venture investors 10 years ago or 20 years ago and said, I've got a services company, how would you like to invest? They would have said, no, thank you. We are looking for some critical aspects of software companies, such as that they have high margins and they scale rapidly. And we're willing to make quite a large investment so that software company can build 100% of the software product and then build the entire sales force before it attempts to do that big scaling. And that's risky, but we're willing to do it because the payoff is so big. At tech-enabled services, so it's unexpected that there is this trend to tech-enabled services, but there are pros as well as cons to tech-enabled services. And there's even some theses that tech-enabled services is uniquely powerful in healthcare. And so I'd love to hear you to tell us, what's been going on, if you give us the big picture, including, are investors happy with how software is going in healthcare, and what are some of the controversies and what you're seeing with tech-enabled services? Because it certainly is true if you follow fundraisers, there's a bunch that are tech-enabled services, virtual care, alternate care delivery models, all of these things involving care. That word services is actually in healthcare, it's often care services. So James, would love to hear your perspective on this.
Great question. So I do want to caveat, I've only been a venture investor for about 5 years now. So I can't speak too directly to the environment 10, 20 years ago, but I've had the pleasure of working for amazing mentors like Alan Patrickov, who's been investing since the 70s, right? So I've gotten good experience and insights from them and how the market used to be. And to your point, the reason why tech-enabled services have routinely failed or not been able to garner investment in the past is due to that exact scalability issue, right? In order to move quickly enough, in order to take a company 0 to 1 and have these big venture scale exits, you really do need something that's easily able to be distributed through the internet or other ways that have very low marginal costs at every single opportunity. And the best way to do that and the best way for investors to screen for that is looking at the gross margin profile. And so generally, if your company is not clearing at least 70% gross margins, the venture math largely didn't make a lot of sense. And traditionally, tech-enabled services, the technology was not yet sufficiently advanced or providing enough leverage and automation to the point that it dramatically increased the margin profile enough for something to be venture backed. And so that's largely, from what I've heard and from what I've seen and can best speculate, why tech-enabled services have largely failed to garner much attention and investment dollars. That being said, I think a big shift in the last few years and why they're coming back is really threefold. So the first one is if you look at the venture scale exits that have happened in the digital health or healthcare space, the vast majority of those companies are actually services companies. There have been very, very few true unicorns and true exits, like as in not just paper gains and markups, but true exits that have been pure software companies in healthcare. The vast majority have been tech-enabled services like Oak Street and others, right? And so I think people in the ecosystem are realizing that, wow, if we really want to build long-term venture scale durable businesses, we likely do have to include some level of services in addition to the tech that we're building.
Let me just throw out that there's also one medical group which was sold in a successful exit to Amazon, and that was a primary care practice that was tech enabled, and then also Hims and Hers. They are virtual care practices where you actually get a diagnosis and then a prescription online, so that you interact with a clinician and you get care online. So just another example of that.
Yeah. And I think that one of the reasons why people have historically shied away from those businesses beyond just those few is that in order to scale them, it's incredibly capital intensive, right? There's a lot of money that has to be poured in and invested in these companies. And that can largely only happen from existing industry players, very large mega funds. And it ends up diluting a lot of the very early stage investors that might otherwise fund it. And so they've realized that, and so have stayed away from that, fearing the downstream dilution that is likely necessary to build a company in that space. And so I think what's happening though is that people are increasingly seeing that developing technology is getting so cheap, it is getting so easy, it is getting so good that there are meaningful technologies that can be spun up much more quickly, that can be meaningfully attached to services to actually allow for both that venture scale from a speed standpoint, but also leverage that technology enough to automate enough of the back office work and enough of the manual work that these clinicians don't need to be doing, so that they can really focus on maximum billable time and maximum throughput and maximum actual care with the end patient. So that's one of the second reason why I think we're seeing a big uptick. And then the third one, I think, is really this understanding that people are starting to see that, well, if technology is now easier and easier to build, if the moats are really coming down to the data and distribution, who does that benefit? And the answer is actually not the startups. It's actually the incumbents, right? They already own all of these distribution paths. They already own all of the data around it to better utilize it. And one of the things that really cemented this, at least for me, was we spent a lot of time in the RCM management space, right? And specifically, we looked at a lot of tools that popped up rather quickly and saw a good early success around entirely automating the claims denial process. And it was really interesting because a bunch of them got venture backing. They were growing very rapidly. And then in 6 months, Morningstar, who is a very large incumbent RCM player, launched their own direct competitive product that was as good or better than all of those startups. And in my opinion, almost killed them overnight because they already had all the distribution. It's now just a part of a broader Morningstar RCM platform. And I think we're going to continue to see more of that from Epic and many of the other large technical software providers, because it's not just easier for people to innovate and start companies and using this tech. It's now even easier for the incumbents to build that tech themselves.
That's interesting. And I've heard all of this, by the way, very powerful and interesting and important for our audience. And I've heard two interesting angles about that. So one of them is that every startup must have two archetypal leaders. One is the salesperson who's focused on the market, and the other is the product person who's focused on the product. And at Apple, Steve Jobs was the salesperson focused on the market, and Steve Wozniak was the product person focused on building the product. And what this does is it makes what AI software development does by making it cheap and easy to build software, is it reduces the importance of Steve Wozniak. And the absolute importance of Steve Jobs stays the same, but the relative importance of Steve Jobs compared to Steve Wozniak increases within the organization. And an organization that is weak on salesperson and strong on product person needs to find that sort of strong on product person. So that was one remark that I've heard about this. And so another one was that, and so incumbents, can be advantaged by this. So another example of this was, it's sort of a back to the future scenario. In the 1970s, computers existed, and you might have had a Boston shoe company with no computerization. And then in comes, some eccentric guy who's a self-taught computer programmer. And he says, why don't I deploy basic database software? You hire me as an employee, and I'll work in this closet over here, and I will build a database backend for your warehouse that's custom just for your company, which has 2 sneaker factories and 3 warehouses, and I have basic database logic like if you've sold a product, you can't sell it a second time, or if the product is in warehouse number 1, it can't simultaneously be in warehouse number 2 or whatever. So he's building this. Then along came the first shrink-wrapped software licensing models of mailing you a DVD or something to stand up and install in your own data center. And then the next model after that was SaaS, where the data is in the cloud and you subscribe to it. And so you have companies like Merck, commercial leader, paying millions of dollars a month in subscriptions for Viva and the various modules of Viva in the cloud, CRM software to empower Merck salespeople. But the next step in the evolution could be back to the future, where Merck just hires 15 software developers in-house and rapidly builds a CRM system that's more customized to Merck than Viva is, and replaces Viva with it and doesn't need to write these big checks to outside vendors. And so the incumbent who has the relationships with doctor prescribers becomes empowered, and the vendors that sell to lose that power because the incumbent can always just hire 15 developers and go build their own version in-house. So those are 2 interesting. And so it's sort of a back to the future. You're getting back to the model of hiring the internal software developer to who can build you a custom solution just for you.
Yeah, I think so. And I will say that I want to make one, not correction, but just like restating of something you said earlier, which is this relevant importance of the 2 co-founders, right? Being both technical and salesy. And I do think that the relative importance of a sales-led CEO is increasingly important, right? You need to be able to figure out distribution and go to market and execute better than anyone else. I think that is more important than ever. But I will say that the need for a really good technical CTO and co-founder, I think, is still just as high as it was before. I don't actually think their value has gone down. I just think the relative value, to your point, of the sales CEO has gone up. And the reason why I don't think it has gone down is, yes, the cost of technology development is going to zero. Yes, it's getting easier than ever, but you still have to have a fundamental understanding of how to architect technical teams, of how to architect how all of these tools fit together, how to think and plan out where technology is going and how to better utilize it as part of the product roadmap. So I think that those high level technical people are going to actually have increasing importance over how do you architect and construct these AI agent teams. I think it's the first few engineers that have probably relatively lower importance by comparison.
Thanks. We have a question from Ken in our audience, which is, can James comment on valuation ranges for tech-enabled services companies with a 65% growth margin, and a size of about 24 million revenue? And he also says remote support. So maybe this is tech-enabled services in the remote support sector. Any thoughts on valuation ranges?
Yeah.
I'll just mention that in the world of SaaS, the current SaaS capital index is at about 7.1, which means that enterprise value is about 7 times revenue on an annualized run rate basis for large public SaaS companies. That's a good reference number when thinking about them. So James, any thoughts about Ken's question?
Yeah, so I do want to preface by saying that we're early stage investors. So we typically look at companies doing a few $100,000 to a few million in revenue. That being said, we have to think all the time about who does this exit to, for how much, when, and why. And so we spend a lot of time looking at and tracking those multiples. And so generally, we've seen tech-enabled services companies in the past exit for 1 to 3x revenue, right? But because the margins are improving and because the growth rates are improving as a result of a lot of the new technology, we've generally seen that 4 to 6x is probably where a lot of these startups will slot in and exit for. So That would be where I would realistically think that you could exit the business for. Now, that being said, depending on your growth rate and depending on the amount of capital you're looking to raise, I think that a fair valuation could range anywhere from 5 to 15x, right? Depending on your growth rate, depending on the team, depending on the market, and depending on what any investor is willing to give you.
That's great. And then Michael points out that even if Merck hired the developers, the hypothetical 15 developer team that I mentioned, they'll still need to maintain it year on year and drive continuous innovation of the internally developed software, which large companies struggle with. Yeah, that's a good point. It'll definitely be a rubber meets the road phenomenon, which is that if Merck can do something that's 80% as good for a 90% discount in price, they might like that trade-off. But if it winds up being only a 40% discount in price, then no one would want that trade-off. And I'll mention that sort of the progression of this is that, first you have the largest and most sophisticated Silicon Valley SaaS companies selling SaaS products at full price, initially delighting customers, but charging a high price for this, creating this large productivity tech stack, the B2B productivity tech stack, which is it's things like the Microsoft Office Productivity Suite and Slack and customer service queue management and all kinds of products that exist in the Fortune 500 companies. That's the first stage. The second stage is, and we've been living in the second stage for 10 years now, is that certain companies like Zoho and others go and the product becomes mature. We know what people want in this product. Zoho goes and rebuilds everything with outsourced to India. That's phase two. And then they present a product that doesn't exactly delight customers, but is good enough for customers and charging half the price of that. And then the third generation of this, there's actually an incubator in Silicon Valley that's called like 8090, and it was founded by Chamath Palihapitiya, who's become famous as he was an early Facebook employee, and now he's famous as one of the hosts of the All In podcast. And they are promising to rebuild the entire B2B productivity software stack again using AI. And it's called 8090 because it will be 80% of the functionality of Salesforce.com or Oracle at a 90% discount to the price. So that's the third wave. And then the fourth wave is that Merck builds it itself with a team of 15 internally. And so we're not sure where Merck or the other companies will hit here. And the existing vendors have market power today. It's not clear how much market power they have, so it's going to be a battle. But thank you, Michael, for that question. And so let's see. Another interesting question is why is there a thesis that tech-enabled services are an especially good fit in healthcare as opposed to other sectors? For our audience, there's B2B, but some of the biggest sectors of the economy are B2B, B2C, and healthcare. And healthcare looks a lot like B2B, except that it's in a specialized, highly regulated environment. And traditionally, the vendors have been unique vendors. So Cerner was a standalone company before it was bought by Oracle. Epic is a standalone company in healthcare. Medidata was a standalone company before it was bought by Dassault Systèmes. And so oftentimes it is not just another part of B2B. It has to be its own thing in healthcare. And so why are people thinking that tech-enabled services from a VC, from an entrepreneur perspective and a VC perspective, might be a better fit in healthcare than in other areas like?
Great question. I think in B2B, traditionally, the reason why technical services haven't been as good of a fit is you usually in B2B have the bandwidth in order to take action on whatever the automation or the software suggestion is, right? You have the ability to hire staff and take actionable next steps from that. In healthcare, though, we are facing a massive clinician crisis shortage, right? We are short hundreds of thousands of nurses and large percentages of specialty and primary care providers all across this country. And because of that shortage, people are booked out for months in advance, right? Like even my PCP, I cannot get it on the calendar for 7 months if I want to, right? And because of that, they don't just need or want software that provides them alerts or automates their note taking. Well, those things are nice and puts time back in their day. What they really need are people to actually do the work for them, right? And in order to do the work for them, you actually need NPs, you need RNs, you even need physicians to staff these digital health tech-enabled service models so that you can then go in and sell and say, hey, I'm not only doing a better job of analyzing this claims data for you, I'm not only doing a better job of actually engaging the patient for you, but I'm also helping to close those care gaps for you as well, while also freeing up your plate to then spend your time on the much more high margin, high value services that you as the provider or clinician are able to offer instead. And so really it comes down to this notification fatigue that we've seen in the industry and the point solution fatigue that we've seen. And so it's really a rejection of that fatigue and saying, great, this software is awesome, but what we actually need for you is to take that software and do something with it for us.
That's really interesting. And I'll throw in a couple other thoughts about this as well. So one is that legendarily in the world of digital health, providers and also payers are terrible buyers and implementers of technology. So you come along, you have a revenue cycle management piece of software, and you go to medical practices and you say, buy this revenue cycle management software from me, and it will automate your back office and it will boost your collection from patients, and they don't buy it. Or they do buy it and they pay full price for it and then they don't implement it. Or they do buy it and implement it and they don't run it very well. And so just for decades, this has been a terrible frustration. You have sort of well-paid sales reps doing their very best to sell a product into a hospital or a medical practice or somewhere and having great difficulty selling, but then they do succeed sometimes in selling the software. And then a key next step is they have to get the client using the software and benefiting from the software, or else the client may not renew the software down the road. And then they discover, and they don't control any of this because they're outside salespeople. And so then down the road, the provider that bought the software and paid for it is not using it. It's not deriving the benefit from it. And so the analogy, and so tech-enabled services is the tech people saying, how hard is it to run a medical practice? It doesn't look that hard. Okay. And then they start with the technology, and then they address an industry that doesn't buy technology well and doesn't implement technology well and doesn't collect the benefits of technology well. It hasn't been doing it well for 40 years. And then they say, we can come in and doctors will be non-essential part-time employees. And we're going to run this like a business. And so that's in part what's happening with tech-enabled services. You go to a Fortune 500 company, and 30 years ago, you would have seen faxes lying around. You would have seen a big photocopier being constantly used in the corner. You would have seen secretaries, sitting in their seats with stacks of pink slips saying "while you were out," there'd be corporate librarian, and there'd be a typing pool, and there'd be a travel agent, and there would be all these things. And then you go today, there's none of them. None of them exist. Even the printer is not being used so much anymore. I'm sorry, the photocopier is not being used so much anymore because they're just using a small local printer instead. But everything is done. Your junior analyst is doing the data librarian work, is doing the typing pool work, is doing the airplane booking work. All of this is just being done through information systems. And then you go to a hospital today and you see a surgeon, the ultimate knowledge worker, and the surgeon has 2 phones and a pager on their belt and is carrying a manila folder, and the manila folder has printouts and faxes in it. They're still using faxes, and you realize that they have not bought technology that works. They've not adopted technology. They're not using it for the right benefit that works. And so someone could come in and start a new hospital, maybe buy the old one, maybe not. And that would be tech-enabled services. And they would actually, from scratch, build the practice in a technology-enabled way. And One Medical Group was like this. Our audience is probably familiar with One Medical Group. For a while, they had 300 software developers in an office in San Francisco while they were building out a nationwide medical practice. So what were those people doing? Well, I can tell you that physician-led medical practices did not have 300 software developers working for them at the time, and were not well-branded, and were not doing a national rollout at that time. So the technologists came in and did something very, very different. So things that physician-led practice couldn't do, didn't know how to do, couldn't do, would not have occurred to them to do. So that's often what's happening with tech-enabled services. And then you also they have the right and the ability as a tech-enabled service to buy the right technology. So this 40-year battle of hospitals not buying, not using technology well, someone who actually understands how the business works comes in, and then they're making the buy decisions, and they're implementing all the technology in tech-enabled services because they're from scratch. They're trying to figure out how to sort of run a better business. So that's another one of the. And then as a tech-enabled service, that's your competition. So you have actually implemented the database backend, you've implemented the revenue collection, you've implemented the marketing front end, the branding, and then you're competing with other chains of medical practices that don't do any of this. They don't buy the tech, they don't roll it out, they don't have automation. And so there's an opportunity there to have higher margins and grow faster than the average care services company in the industry. So I don't know if you have any thoughts on that.
Yeah, I mean, I think you bring up something really interesting, which is this idea that there's kind of this hubris, I think, that a lot of tech founders can have to reform healthcare, right? Where if you move fast and break things in other industries, that may work. But if you move fast and break things in healthcare, people die, right? There is actual risk that happens when things go wrong in healthcare. And so as a result of that, that's why largely people are also very slow and hesitant to adopt new technology in healthcare. Is it not just has to provide ROI at the corporate level, it also has to provide ROI at the individual user level in order to get their usage, to your point earlier. But it also has to be safe, provable, and identifiable, which is one of the things that AI is worse at, right? It is a massive black box that is really hard for us to explain. And so by coupling that potentially black box with actually accountable services, you can get through a lot of those risk issues that might otherwise come up as well. But to your point around like the potential hubris of this and the idea of let's start new medical practices, that's a really hard thing to do. And it doesn't matter how good your tech is internally to operate them. If you can't manage the people and manage the actual day-to-day of the business, it's not going to matter. And so we've really found that some of the best companies we've looked at have truly had not just a sales CEO, not just a strong technical lead, but also a really strong chief medical officer that has built and scaled services businesses within healthcare before. And we really see that as kind of the holy trifecta to be successful in this industry.
And an interesting example is the case of Uber. So when Uber was just being born, they had a choice to make. Do they be a software company that sells software to taxi cab companies and logistics companies? Or do they become a logistics company, become a taxi cab company and sell rides, not software? And I think we all know which way they chose to go. They chose to sell rides, defeated the competitors. Now, about those competitors, they were in the logistics industry. They famously were bad buyers and users of technology in the logistics industry. The taxi cab industry is a disparate industry, but they had many chances to buy excellent logistics software and implement it, and they didn't do that. And then along came Uber and ate their lunch. And also, some of them are highly regulated as well. And so part of Uber's victory was a victory of figuring out ways around regulation as well. So, but that's an example of a company. If they had tried to be a logistics software company and go around selling software to taxi cab companies, taxi cabs would have said, I don't want to buy your software. I don't need to buy your software. And if I bought it, I might not use it well. And so they decided to become a tech-enabled services company and compete on that basis in that market as well. And so in that sense, it looks a little bit like healthcare. And then we have a couple of questions here. One is Ravi asks, James, how do you see valuations for seed stage and Series A stage digital therapeutics, embedded digital care plus companies when compared with tech-enabled services companies, especially when differentiation and moat is digital therapeutics, which is regulated? Digital therapeutics, my understanding of digital therapeutics, it would be talking about prescription digital therapeutics, which means prescribed by a prescriber, reimbursed by a payer, like Click. Does this sort of thing. And so the question is valuations for seed and Series A digital therapeutics when compared with tech-enabled services companies. So any thoughts about should it be higher, same, lower?
So I take this all with a grain of salt, right? We do not invest in digital therapeutics companies, pharma therapeutics companies, anything that requires FDA approval. It's just not a risk that we're generally comfortable and knowledgeable enough to fully underwrite in the way that would be fiduciarily responsible. So I will pontificate based on what I've seen in the market and based on other investors I know who I've talked with that are much more close to that market. And so I think it really comes down to like, are you post FDA approval or are you pre-FDA approval, right? I think if you're post-FDA approval, you're probably not looking at a seed Series A necessarily, but you might be because you're looking to commercialize. And if you're pre-FDA approval, right, you very clearly aren't going to have any revenue associated with this business. And so any funds that you raise will generally come down to a calculation that is really more based on dilution, right? And so at a seed stage, you generally want to give up between 10 to 20% of your company. And so based on how much capital you need to raise, you can then kind of back into the valuation from there, right? So say you only want to raise I don't know, $1 million, right? That likely means that you're comfortable raising at a valuation between 5 to 10 million, so you can give up that 10 to 20% equity in return for that slice of the business. Now, for Series A, if you're a little further along, you're looking to say maybe raise 10 million in capital. You generally, for these types of companies we've seen, have to give up between 15 to 30% of your company at your Series A to raise that amount of capital. And so doing the same calculations, you can kind of back into what the valuation likely looks like. So it's much less about multiples, because for the type of company I am assuming you are, based on the description, you likely don't have revenue at this stage, right?
And I'll add to that. So that was a great question, Robbie. I'll add to that in theory, a prescription digital therapeutics company ought to have a higher valuation than a tech-enabled services company, because in theory, it will have higher margins and it will have the faster ability to scale. In practice, I don't think any prescription digital therapeutics company has succeeded with a hit product yet. And there's a number of reasons. One is that their IP is a little different, offers a little less protection. The second is that they have to win every sales battle. They're not just, they're not just approved by CMS for reimbursement immediately and for an unmet medical need. They have to kind of go provider to provider and persuade providers to adopt. That's a medtech-like battle, not a biotech-like battle that they face there. And then they also face issues around usability. And so there's just a number of issues that have to be resolved before, in theory, they ought to be able to have high margins and scale like molecular biotech drugs. In practice, that has not worked out as neatly as we would have hoped. But if they did have that ability, then they would clearly have a higher valuation than the tech-enabled services. And so then also Kimberly mentions that existing providers don't have the time to migrate patient records and billing from their system to a new one, and then they don't have the time to learn how to use the new system. Yes, very true. That's one of the many good reasons why providers have difficulty with buying and using tech. Another is that the old fee-for-service system really wants to hire expensive people and then build them at the top of their license. And technology is this kind of nuisance goo that gets in the way of that and costs money and gets in the way of that. Whereas with value-based care, what that business model wants to do is fire all the skilled workers and replace them all with automation. But most care is still done under the old fee-for-service model. And so Kimberly, I'll tell you a funny story. Once at a company, we did a deal and I was the deal guy. And so I was typing 24/7. And before you knew it, I had sore hands and wrists and that sort of thing. So I went to the doctor. I couldn't stop typing for my job, literally. Went to my doctor and he talked to me about it. And he was and I also noticed they were doing an EMR implementation and it looked very weird. People were walking around with open laptops, typing into laptops, but they hadn't got rid of their paper systems yet or whatever. And so he told me about taking breaks and good ergonomics. And then he also said, you should consider wearing wrist braces. I was like, really? Wrist braces? That's so unfashionable. How can I possibly be seen wearing wrist braces or whatever? He's like, yeah, if, wear them during the day or at night in bed. And if you can't wear them during the day, then still wear them at night in bed or whatever. So I got the wrist braces. I'm wearing the wrist braces. And I was like, how's your EMR implementation going? And he's like, oh, it's terrible. Everyone hates it. It was eClinicalWorks. He's like, everyone's typing so much more here and everyone's staying late to get data that might have been written down on paper and then re-input it into the system. And nobody likes it. And it's not efficient. It's hard to get used to the workflows that they're not efficient or whatever. So anyway, so then time passes and like 3 months later, I visited my doctor a second time and they put me in the exam room and I'm sitting there. And then a few minutes later, in comes my doctor and he's wearing wrist braces because the EMR implementation gave him carpal tunnel syndrome or something. So and Kimberly, I think part of the root of that is that EMRs are basically billing systems, not medical record systems and not workflow automation systems and still are. And that's why they look bad and are hard to use and slow doctors down. And then Michael comments, new technology like AI requires transformation of the workflow across healthcare. That's one of the major issues for adoption. Yeah, you have to, a smart person with resources has to figure out the whole new way it's going to go with AI before people can begin to embark on that journey. So Michael, thank you. Any James, do you have any comments on this before I go on to the next?
Yeah. I mean, I think it hits the nail on the head and speaks volumes to why tech-enabled services really seem to be where both the market and investors are headed, right? Which is that everyone knows there's all this amazing technology that's coming, but most people don't have the time, resources, or knowledge to really figure out what's the best of the best, how to integrate it, the time to integrate it, the persuasion and political power internally to integrate it. And oftentimes there might be an ROI at the corporate level, but the ROI for each individual user of the product might be much lower, right? And so instead of taking that bet that the ROI doesn't pay off at either the macro executive level or at the micro individual practitioner level, instead really focus on tech-enabled services that do that work for you on your behalf and free you up to be the best version of yourself, to deliver the best care, to focus on the patient experience at the end of the day. So that's kind of really where we think the market's headed. And I think that to that point, it's also why I think marketplaces are going to be increasingly important and increasingly interesting, as it empowers people to really strike out on their own, or to start their own practices, or to utilize a lot of this technology in net new ways as opposed to in incumbent ways.
So we only have a few minutes left. So for our audience, any further questions? And then Daniel in our audience writes, we're a tech-enabled healthcare service that addresses sleep apnea. We are offered on LilyDirect as the telehealth provider for sleep apnea, and we're partnered with ResMed and Inspire Health and have built trust throughout the industry. We're growing quickly and will double our volume revenue in the next 4 months. We'll be cash flow positive by August. Long story short, does it make sense for us to raise venture-backed capital in a Series A to keep the pedal on the gas, or do we let current momentum and revenue drive our growth?
I think it really comes down to what your priorities are. Do you want this to be the category defining business of the future? And if the answer is yes, then maybe venture dollars make sense, right? And I think that you're approaching venture in the right way, which is you're not building a company to raise funding. You're building a company that lasts, is cash flow positive, is durable. And you're looking at the capital merely as means to accelerate what's already working, as opposed to a Band-Aid to fix what isn't and extend runway, right? So the calculation that I would recommend making if I were you is, hey, we're about to reach cash flow positive. Am I okay with the status quo and with the growth rate and with reinvesting those profits at the rate that I can? And am I comfortable having this be either a lifestyle business or a moderately successful outcome at some point in the future? Or do I want to take the risk and pour venture dollars on this and really accelerate? And the reason why I say a risk is that venture dollars come with strings attached, right? It is not just free money on the cap table, right? Venture dollars require that you are willing to double or triple your revenue every single year for the next 5 to 6 years. It means that you are dedicating the rest of your career in a way to putting it all on the line to scaling this business as fast as possible. And so that's really the calculation that I would be making is, are you comfortable taking the risk to work harder than you've ever worked to scale this faster than you've ever scaled it, with the chance it all goes under and you burn too much cash? Or are you more comfortable with a smaller outcome, a more stable outcome, and continuing to grow with the status quo? I don't think either option is bad. I think it really just comes down to you and your team's preferences.
Really interesting, Hicks. And then, we're about to reach the 90-minute mark. So this trend toward tech-enabled services, investors liked this trend, and we're shifting toward this trend in digital health. 3 years ago, 5 years ago, it's gained momentum during that time. And then 3 years ago, all of a sudden, the biggest technology shock of our lifetimes hits, which is generative AI. And generative AI it makes software cheaper to develop. It also adds intriguing feature functionality to software that wasn't possible in the past. And so how does this play into, how would this affect a vendor that sells software into the healthcare industry versus a vendor that is no longer a vendor, has become a tech-enabled services company and is the the care provider in industry? And does it accelerate the tech-enabled services trend, do you think, or something else? How do you think AI is impacting?
Well, I think that AI is what makes tech-enabled services viable in the first place now, right? I mean, the classic adage in venture is that being early is being wrong. And I think a lot of tech-enabled services have historically failed because the tech was not good enough, automated enough, taking load off the plate enough in order to really boost margins from 20, 30% up to the 60, 70% necessary for venture scale. And I think that the technology of Gen AI is now to the point that in the right use cases with the right people who know how to put them into workflows, you can meaningfully deliver better services at twice the margin profile. And so I think that if you can figure out how to build one of those companies that leverages tech in that way, like that is the make or break going forward. I think if you're an existing software company that relies on just selling software, I would be very worried right now if I would. I think that we're seeing it very rapidly with a whole host of unicorns across a number of industries that raised lots of boku dollars from 2017 to pre-Gen AI that are seeing their growth plateau and flatline entirely or even start decreasing because the new AI solutions are that much more automated, that much more interesting. So I would, if I was a SaaS only company, be thinking about, well, can I deliver services? Is that something I can build out on top of my software? And or what parts of my product can I actually become AI native in? Can I lead with a new AI product that does the same things that I've already been selling, but better? And I actually think that you have an advantage as an incumbent who could do that, if assuming you're nimble enough. And the reason why is you already have those customers. You already have the data that you've been accumulating over however many years of using that software. And so you have a lot of these advantages we talk about with incumbents. The question is can you move quickly enough to use those advantages with the newest tech that's iterating?
Really interesting. Thank you. That's actually, I think you just concluded with one of the most intriguing and interesting points of the whole show. So thank you for that. So you've been listening to the Digital Health Investor Talk show with host Stephen Wardell. Our thanks to our guest today, James Hueston of Primetime Partners. Thank you so much,
Of course.
James.
Thank you so much, Stephen. It was a pleasure to be on the show, and I really appreciated the line of questioning and where we're going. I think despite the macro turmoil we're seeing, I am long-term very bullish on innovation, on healthcare, and on the indomitable human spirit to persevere. So I think we'll figure it out.
Thank you. And we're publishing this show as an episode of the Digital Health Investor Talk show. Subscribe on Apple and Spotify. Don't forget to rate us. And our next show is Wednesday, May 7th, which is Now We Need to Win the Scale Game with Chrissy Farr and Alyssa Jaffe. And for our Boston audience, the next Boston Health Innovation Night is Thursday, May 15th at 5:30 at the Liberty Hotel, which will feature an AARP executive talking on agetech. Charlotte Ye will be talking on agetech, a new narrative for aging. So looking forward to seeing you all there. And thanks so much, and signing off for now. Thanks. Bye-bye.